So I had the opportunity to contribute to an symposium focused on more an educational on how certain behaviors, including physical activity, can be of help throughout the cancer care continuum, in this case, breast cancer care continuum. So I'd like to summarize my intervention by giving specific highlights of my presentation regarding the impact of exercise on prevention of cancer, first of all. So speaking of individuals that have not received yet a diagnosis of breast cancer, we now have strong evidence of the associations between exercise and reduced incidence of at least 7 types of cancers, including breast cancer. And for breast cancer, this risk is reduced by 10 to 20% among people that exercise regularly versus people that have a more sedentary behavior. And when we look at what type of physical activity can exert this beneficial effect, it's really across the different types of activities. So occupational and household, transport activity, leisure time activity, even just walking can be beneficial. Now, moving to what's the link between exercise and mortality among individuals that have already received a diagnosis of cancer. We do have evidence of reduced mortality among individuals that have been diagnosed with colon, prostate, and breast cancer for increased level of exercise versus more sedentary behaviors. And now there's studies and clinical trials investigating whether exercise can also reduce cancer recurrence and not just mortality. But focusing on mortality, we do have consistent relationship between increased exercise, either pre-diagnosis exercise or post-diagnosis exercise, with all-cause mortality and cancer-specific mortality. And this is relevant for several types of cancers, including breast cancer. But I think it's very important to also highlight how exercise can be beneficial on a number of health-related outcomes and cancer-related outcomes. Specifically, we do now have guidelines and recommendations with very clear prescriptions of exercise that we as physicians can make to improve survivors of different types of cancer better cope with long-term side effects of cancer and cancer treatments. So I will just pick one example, that is cancer-related fatigue. We now know from evidence from more than 100 clinical trials and multiple meta-analysis that exercise is very beneficial on fatigue, and that its impact and the effect size of exercise interventions, it's larger than many other pharmacological interventions, which in fact prove very little impact on cancer-related fatigue. And usually these pharmacological treatments are reserved to very specific niche and the cancer treatments, such as end-of-life and palliative care. So when I think of recommendations that are very practical for our patients, I usually refer to recommendations from large cancer society, for example, the American Cancer Society or ASCO or the American College for Sports Medicine, that overall are very consistent in recommending 30 minutes of physical activity, aerobic activity, moderate intensity, 3 times per week, coupled with 2 sessions of resistance training. And this is during treatment phase. Then in the post-treatment phase, we can say that recommendations are very consistent, increasing activity to 150 minutes to 300 minutes of moderate intensity aerobic activity per week, always associated with twice per week resistance training, flexibility training, and stretching. I think, just on a final note, what we retain from the EBCC conference this year is that additional evidence and high quality evidence is coming also in the metastatic setting. In the conference, the results of the PREFERABLE-EFFECT study, this is a randomized controlled trial in Europe and Australia, randomizing patients to a 9-month exercise intervention versus control. The study demonstrated a very meaningful impact on quality of life and physical fatigue, as well as a number of other outcomes in metastatic breast cancer. So more and more evidence supports the notion that we truly can apply safely and effectively exercise throughout the breast cancer care continuum.